Dictation will begin after 5 seconds. Start. The symptoms of COVID 19 infection are well documented, full stop. There is a growing body of literature on the epidemiological aspects of the outbreak, full stop. Its social and economic faults are become apparent, full stop. However, conversations on pupils' emotional well-being during the pandemic are by and large talking pupil emotional place only within specialized circles, full stop. There are pressing reasons that this discourse is urgently mainstreamed, full stop. During times of strife such as natural calamities, wars, and economic hardships, people reach out to each other, full stop. The novel coronavirus outbreak, however, circumscribes such behavior, full stop. To combat the virus, millions have been forced to isolate themselves, sometimes even within the same house from those they interact with every day, colleagues, family, friends, full stop. At the same time, the outbreak and lockdowns have plunged the world into uncertainty, full stop. All this warm experts will take a toll on pupils' mental health, especially those who already suffer from anxiety disorders. Para. In the first week of February, when the outbreak had not yet taken the form of a pandemic, a paper in the medical journal Lancet pointed out that patients with confirmed COVID 19 may experience fear of the consequences of infection with a potentially fatal new virus, and those in quarantine might experience loneliness, anxiety, and anger, full stop. The paper by 7 Chinese researchers also warned that even the onset of symptoms, fever, breathlessness, and cough, could lead to anxiety and mental distress. Full stop. With India reporting at least three coronavirus related suicides in less than a week. According to reports, 7 people took their lives in Kerala due to depression caused by not being able to buy alcohol. The country's public health authorities need to take the warnings of the Chinese researchers seriously, full stop. They also need to pay attention to the emotional well-being of healthcare workers, full stop. Mental health experts point out that such workers may experience fear of the contagion and panic at the prospect of spreading it to their families, friends, and colleagues. Full stop. A study published last week in the Journal of the American Medical Association, based on a survey of 34 hospitals in China, for instance, reported that more than 70% of the doctors and nurses who attended coronavirus patients have experienced psychological distress. Para. Many countries, including India, have set up helplines for mental health issues precipitated by the pandemic. Full stop. It's imperative that information on these helplines is made widely available. Full stop. Experts, including the authors of the Lancet article, warn that psychological scares of the pandemic could be long term. Full stop. They recommend regular mental health screenings of healthcare workers and patients who have been through quarantine. Full stop. It is imperative that the battle on the mental health front is now integrated into the war against COVID 19 para. In the season of social distancing, it may be argued the social lubricant is unnecessary. Full stop. But while governments the world over batter down all hatches in response to the novel coronavirus, and the World Health Organization opens in the face of empirical, if anecdotal, evidence to the contrary, that alcohol is an unhelpful coping strategy for lockdowns. Certain progressive governments are refusing to be illiberal. Full stop. Para. In the UK, where the Prime Minister is in self isolation and the Health Minister has tested positive, of licenses are back in business, and the pub, the cornerstone of British social intercourse, could also be drawing pints of warm beer for takeaway soon. Full stop. And in Kerala, alcohol is deemed to be as important a service as the supply of medication, and the excise department is duty bound to supply anyone presenting a doctor's prescription. Full stop. Their commitment of human rights and support for personal choice is exemplary. Full stop. What a dismal contrast the rest of Indian presents, having to make do with a cruel WhatsApp joke which assures the recipient of home delivery of two bottles by the government, but clicking on the link calls up a picture of an ape making a rude gesture. Para. It is not only about rights and preferences. Full stop. The sale of alcohol brings thousands of crores to the state coffers, revenue that will be needed to defray social spending on the coronavirus crisis in the months ahead. Some of it would pay for the treatment of conditions like depression and anxiety, which the moderate use of alcohol helps with. Full stop. The health authorities present alcohols as a problem and focus on the obvious damage wrought by excise use. Full stop. But taken in moderation, it can be a solution. Full stop. Archaeologists currently believe that making bread may have been a byproduct of making beer. Full stop. The ancients knew that what was good for them. Full stop. That's all.